pain is inevitable, but suffering is optional.
And the fact that even though I went through all of that, all of these bad things, I'm still here and I'm still resilient, and I am taking the time to make my life better than it has been. And that gets people to change. There's a part of an article I'd like to read. I read it when I was preparing for this interview. It's by Sean Jin Wright. The future of healing, shifting from trauma-informed care to healing-centered engagement. And one of the things that stuck out to me is Sean said, a healing-centered approach to addressing trauma requires a different question that moves beyond what happened to you to what's right with you, and views those exposed to trauma as agents in the creation of their own well-being rather than the victims of traumatic events. We're not saying the trauma didn't happen. We're saying you have trauma and you experience this, but give them the hope of the future and not letting them only identify as a victim of trauma.
I really like that, the healing centered, because at the baseline of working with trauma survivors is really that, because you have to empower them to want to be healed and to find that healing within themselves and in their lives. So how do you do that? I think taking part of what you said, this author said, which is focusing more on the person and the elements that they already have within them to heal themselves is a good way to do it. But sometimes it's a matter of reframing. Okay, you see this as I've failed in life this many times. But to reframe that, but look at how many times you've succeeded. Look at how you've succeeded in this. Look at how well you did in this. And to reframe it and so that they then look at their wins and not their losses.
Yeah, we have to get people to learn from their losses, but feel the joy of their wins.
Yes.
And I think people feel from their losses and discount their wins.
Yes, I worked with a psychiatrist years ago when I was first in graduate school. And he said something that stuck with me all these years later, which is, pain is inevitable, but suffering is optional.
I like that.
Which means we all are going to experience pain at some point, but it's how you deal with that pain. And if you choose to suffer, which is what separates the winners from the losers.
Yeah. For many people, I think to truly feel resilient, you have to feel that there is hope for the future. In fact, now that I'm saying that out loud, that could almost be the definition of resilience.
Yes.
Is believing that there is something ahead of us worth sticking around for and worth fighting for. So if we know that the feeling of hope can build our resilience, how can first responders and health workers inject hope into these interactions with patients?
That can be the more difficult part of it all, because one of the core features of major depression is hopelessness.
Yeah, right. It's the literal opposite.
Yeah, so if you're dealing with people who are hopeless and they don't see the hope in it, you can come in and try to offer them ways of reframing that and looking at that situation differently. But then, like you said before, if you go back to the same environment, the same house that reeks of hopelessness, then there you are, you're back in that space. So sometimes for therapy, working with a person and me being an outsider and me having the hope is enough to model the hope for my patients.
Yes.
Because they see that, okay, this person is knowing my whole story and this person still has hope. So sometimes that's enough to give them hope.
You equipped your clients with resilient practicing strategies or strategies to help them build their resilience.
Yes.
What are some of those strategies?
Mindfulness is a way for patients to center in and be aware of the surroundings in a current moment. So an example of a mindfulness technique might be for them to check out their 5 senses, pick out 5 things in the environment that they can see, and then go down a list, 4 things that you can hear, and so on and so forth. Because what that does is, let's say you're in a traffic jam. Everyone gets stressed out by traffic jams. If you're sitting in a traffic jam, you're focused on, why am I not moving? am I going to be late for the next thing? But if you can get a person to focus in on the things around them in that moment, it tends to calm them down.
Yes, yes. Okay. So mindfulness is a big one, something that everyone can do. Anything else?
Other things to help with resilience is support. And I think the research says that for a person to have support around them, so friends, families, maybe coworkers, neighbors, anyone that can be a support system to that person is a big way to help them be resilient, because those people around us are going to remind us of how strong we are, how we've conquered other things before. Hey, come talk to me today if you need to go out for a drink, let's do that. So support system is also a good component of that for resilience. Another thing for resilience is really therapy that can help, because sometimes a therapist is the only person in the person circle that lets them know that they can overcome this, and to inspire them and to push them. Everyone doesn't have that in their lives and in their circle. And I think a lot of people take that for granted. Sometimes I even take it for granted. Sometimes I wonder, like, I think this person can really do this on their own, and they don't think they need to come to therapy anymore. I think we're good. But then I look at the support in their life and it's lacking. So maybe I am it.
Right. There's a reason I end every series and almost every other video we do at MedCircle with "You got this," because it is, for those people who don't hear that, what a shame.
It is a shame.
What a shame to not hear that from your friends and your family. If you're only hearing "you don't have this," you'll never move past this. When you hear different versions of basically "you are your trauma," that's the wrong message to send to people. That message does not get people to the next level.
And if you add on to that, sometimes the recording and the script that's going on in a person's head is that already. So then if you add these external factors to that are negative, they don't have a good chance of recovery. So sometimes therapy is the one thing that they need to continue for years in order to stay on track.
We're getting two sides from the therapist, from the patient's perspective. We're getting the validation that I actually did experience trauma, because maybe I thought what you consider trauma was just normal life. And so you're validating some feelings that I probably have around something I went to. But then you're also giving me a attitude to model of hope and resilience, and then tools to take with me outside of the office, including mindfulness and disconnecting, disengaging, and centering myself. When we attack it from all of those ways, I feel very hopeful for people, because I can see that we're taking a more holistic approach at their mental health.
Yes, and it is what you said. It's very holistic. I don't know a lot of therapists that only look at things one way. Usually we look at the whole system of the person. So it could be that most of a person's trauma and their anxiety that's a result of the trauma is really due to a lack of diet and exercise. So what if I don't live next to a gym? What if I can't afford a gym membership? What can I do to then exercise and get the serotonin and endorphins moving enough so that I can feel better? So sometimes it's a multifaceted approach that involves lots of different things that may not be psychological in nature, but can be effective. So like I said before though, sometimes giving the patient hope and saying, well, I see your situation, I know you're strong, and I know you're competent, and I know you're resilient, and I believe that you can overcome this, and this is what makes me believe that. Sometimes that's all they have. So sometimes if they hear me say that, they're like, you know what? I'm okay.
Sometimes that's all they have. Sometimes that's all you need.
Sometimes that's all you need. So you can feel hope vicariously from other people. Because sometimes they'll say, I don't have hope, but your hope will make me do this week, and then I'll be back.
It's really good. When you said to make sure that when you're dealing or speaking with a patient, that you say, I believe you can do it, and I think there is hope for you. In that room with a therapist, a psychologist, or psychiatrist, we focus on the problem so much. What's wrong? And it's so nice to hear what's right with you. You know, that gives you such a spark to go, yeah, I did come here because I had a laundry list of things that I'm mad at, that I'm angry at, that I suffered from, that I didn't deserve. But I also got a little reminder about the amazing things that I did. And the fact that even though I went through all of that, all of these bad things, I'm still here and I'm still resilient, and I am taking the time to make my life better than it has been. And that gets people to change forever.
Yes. Hope.
Oh, huge. And I thank you for watching this series and joining us for this wonderful, wonderful conversation around community-based violence and what to do. What to do. I hope you found that valuable. I'm Kyle Kittleson. Remember, whatever you're going through, you got this. Thanks for watching. Check out the links below for more information on how to access this full series, and subscribe to our YouTube channel to watch new mental health videos every week. Did you like what you heard in this video? If you want to ask a MedCircle doctor a question directly, you can learn how by visiting the links in the description below.